Hi, my name is Nidhi Sharma. I'm a women's health physical therapist here at Funk Physio Physical Therapy. So today I'm going to talk about painful intercourse or pain with sex after giving birth. It's not really talked about. Doctors unfortunately don't ask about it in postpartum visit. Women don't complain about it or don't tell anyone, and often in the society it's thought of as normal. Okay. Research shows us that it happens in about 1 in 3 women. So about 35% of first-time moms will experience pain with intercourse that extends from 6 months to all the way into the year and beyond. So not only does it happen quite often, it also does not go away for quite a while, and sometimes does not go away by itself at all. Okay, so there are a few reasons why the painful intercourse happens, why some of it gets better and why some of it doesn't get better. So I'm going to explain all of it. There are 3 main factors that cause painful intercourse after giving birth. First and foremost is perineal trauma. Perineum is the area between your vaginal opening and your anal opening. So we're looking at the pelvis, and if we look at the bottom, it will be the vulva, this will be vagina, this will be anus, and this is the area between these 2 openings, which is called perineum. This is where the tears usually happen when you give birth, and this is where sometimes the doctors put a cut, episiotomy, to enable the baby to come out. This trauma, this tearing or incision, and then the scarring that comes after it is the main cause, number 1 cause of painful intercourse after giving birth. There are different degrees of tears where, just a little bit of skin is gone, or skin or some muscle is gone, or beyond. I have another video where I explain all the grades, so go check that out if you don't know about the grades. But regardless of what grade it is, all grades will limit the stretchiness or flexibility of the vaginal opening here. Okay, and when this part is scarred up because there is a incision there, there are stitches there, then this area won't stretch as well, and that is the cause of painful intercourse in most first-time moms. This scar will not just go away by itself. Okay, so when a scar forms after any injury, so let's say this is your skin, right, and when you move your skin all different ways, it has some sort of flexibility, right? You can move it. When there's a scar, and you can check this on any scar of the body, when there's a scar, this mobility in all different directions is limited. Now, this mobility also happens to be here, right? So when there's a scar here, this tissue does not move down or stretch as well. And we really need to work on this scar to get that mobility or that flexibility back and decrease the pain with intercourse. Usually you can start working on this scar 6 weeks after giving birth. You can go to a pelvic floor physical therapist who will teach you how to work on this scar as well. The second cause of painful intercourse after giving birth, the second main cause is stress and postpartum depression. Postpartum blues and stress, lack of sleep, overactivity, fatigue, all of those things are so common after you give birth. Those are the causes for postpartum depression, and that also correlates strongly with painful intercourse. So if you're having mood swings or baby blues, or you think you might be progressing towards postpartum depression, it's very, very important to take care of it, because that will automatically help some of the painful intercourse problems. And number 3 cause is breastfeeding. So breastfeeding does cause low estrogen in the system, and low estrogen causes vaginal dryness. Vaginal dryness means the tissue of the vagina might be a little more sensitive to friction and pressure, and both of those can cause pain. That is a fairly easy to solve problem, because you can use external lubrication, and that will make intercourse less painful because the vaginal dryness would be taken care of. So 3 causes: perineal trauma, stress, postpartum blues, postpartum depression, and breastfeeding. And if you take care of all 3 of them, the intercourse should not be painful few months after giving birth. Definitely should not be painful for 6 months or a year after giving birth. If you are having painful intercourse problems after childbirth, please talk to a pelvic floor physical therapist. We can help.